Thank you so much for watching today. Today at Mid-Level U, we have a special guest, Alex Fisher. She's an attorney at Thompson Burton. She practices here in Nashville, Tennessee, and she works a lot with nurse practitioners, particularly when they find themselves in some sticky legal situations. So today I wanted to have her talk to us a little bit about the disciplinary process when it comes to nurse practitioners. And if you do get in trouble, hopefully it won't happen, but what does that process look like? What do you need to do? So can you start out by telling us a little bit about the difference between disciplinary action and medical malpractice? This is something that I think, I initially didn't understand when talking to you, and I think a lot of people don't. What are the differences? Can you really delineate those two for us?
That's a great question. I have to explain this to other attorneys all the time who don't understand what my practice area is. So medical malpractice is what most people think of, and it's when a healthcare provider is sued by an individual, usually a patient or a patient's family member, who's dissatisfied with the results of a procedure, and they're sued in civil court. And so it's an individual against the healthcare provider, and what's at stake is money.
Okay.
So let's contrast that to what I deal with, which is the Department of Health on one side, the provider on the other, and they're usually investigating some complaint, so they have an allegation that this healthcare provider has done something to violate the rules and regulations of their profession. And so what's at stake is that individual's professional license.
Okay. And so we've talked a little bit about how complaints might be brought before the Department of Health, a supervising physician, a patient, a coworker. Complaints can be brought before the Department of Health. Yes, bitter ex-husband. So complaints can be brought about for a variety of different ways, but once that complaint arrives on the desk of someone at the Department of Health, what do they do with it?
That's a good question. It took me a while to figure out as well. At least here in Tennessee, the way the process works is if the complaint is valid, so the complaint is you misprescribed and not this nurse practitioner is a jerk, it will be assigned to an investigator who's usually a healthcare provider, maybe a retired nurse, maybe a nurse practitioner, and they'll begin investigating. So their investigation will be maybe pulling patient charts from your office, talking to people you work with, talking to patients, talking to whoever filed the complaint, trying to schedule an interview with you. And then once they complete their investigation, that file will then be transferred to an attorney in the Department of Health who will then decide if your license is going to be disciplined or not, at which point you'll get a letter in the mail.
Okay. So if we do get that letter in the mail, what are some of the consequences that nurse practitioners might face? Are you automatically going to lose your license, lose your practice, or is there some gray area? Is there some graduated sort of punishment, for lack of a better word, that you could be facing if you do have some disciplinary action against you?
So people usually freak out, understandably, when they receive a letter in the mail from the Department of Health. But what can happen is a really broad spectrum. It ranges from having your license revoked to a letter of concern.
Okay.
So starting at a letter of concern, you can then have a reprimand. You can be put on probation with certain terms, maybe. You can have your license suspended, or of course you can have your license revoked. And that revocation can be permanent, where you can't reapply, or it can allow you to reapply for your license within a year or two.
Okay, great. So it sounds like there's sort of a lot of graduated process when it comes to that, depending on sort of what you've been convicted of doing. If you are investigated by the Board of Nursing or Department of Health in response to a complaint, what should you do when you find out that disciplinary action is being taken against you or a complaint has been filed? Once you stop freaking out, kind of collect your thoughts a little bit, what are the next steps that you should take?
So a healthcare provider's initial reaction is typically either one, to ignore the investigator altogether if they're trying to schedule an interview, or two, to sit down with the investigator and start crying and tell them their life story. And neither of those is really advisable. It's good for you to speak to an investigator, because that way your side of the story is in that big investigative file that then goes to the attorney later on, who'll decide if there should be discipline against you, and if so, which of those levels of discipline it should be. I always recommend that anyone, whether they want to hire me or not, hires an attorney to represent them at that stage, so that when they go in to meet with an investigator, they don't end up oversharing. I've actually had a client get additional charges added on because of things they told the investigator during their meeting with them.
Okay, so it sounds like having an attorney is definitely advisable, not just because you are an attorney, but someone to sort of advocate for you, inform you of the process, and someone who's just had some experience in dealing with this.
Right.
One thing you mentioned before when we've talked is that a lot of people react emotionally to this as well. And so even if you're smart, nurse practitioners are smart, physicians are smart, this is something that's personally happening to you if you're the one getting in trouble. So even if you think you have sort of the mental capacity or the judgment to handle it, just having a third party who's neutral and sort of removed from the situation is always a good idea. Just like we do in other areas of our life, I think that would be really advisable to hire someone to help you out if you do find yourself in some sort of circumstance like this. So
exactly. And kind of the maxim for attorneys is attorneys should always hire an attorney to represent them. And the same is true for other professionals.
Right.
I represent a lot of incredibly bright nurse practitioners, very bright pharmacists and doctors who are so emotionally invested, and it's such a charged situation in which they're being investigated that you really need kind of a disinterested third party who can come in and advocate and fight for your behalf. So I think it's really helpful to have someone, and I would certainly do the same. Hopefully I'll never be in trouble, but I would definitely hire someone to represent me too.
Right, I would as well. So, well, thank you so much for being with us today, Alex. I've definitely learned a lot. Alex Fisher works at Thompson Burton here in Nashville, but she's available to answer questions from nurse practitioners all across the country. So if you find yourself in a tough legal situation or you just have a few questions, feel free to shoot her an email. She's happy to help. She deals with nurse practitioners all the time and really has some great insights to offer. So thank you for being with us.
Thanks, Erin.